Hemorrhoids are actually scientific names for the common man's name called piles. Most of us will know them as piles. And what it is an abnormal swelling of the blood vessels in the anus. It is very common in Singapore, and perhaps because we love to eat. And the presentation, usually it is bleeding when you pass motion. Classification of hemorrhoid stage 1, you cannot see the hemorrhoid from the outside. That's why the picture here is black in color, because you can only insert the scope in and you can see the hemorrhoid from the scope. Now for stage 2, 3 and 4, that is when you can actually see it from the outside. As you can see the anus and then sticking out. Stage 4 is the worst, where it cannot be reduced at all. It's painfully sticking out, it's bleeding, the patient is in distress, and then stage 3 is somewhere in between. A lot of people believe that hemorrhoids are due to the lack of fiber, but we know also that there are a group of people that there is a hereditary cause. Father has hemorrhoids, grandfather, granduncle, or great-grandfathers, they all have hemorrhoids. And so these are hereditary. Now, besides the lack of fiber, the other things would be spicy food. These are also, because it irritates the anus. You know that very well that sometimes when you eat spicy food, you tend to go to the toilet a little bit more. When you tend to go to the toilet more, you traumatize the anal area, and that causes bleeding. Some patients complain of two things. One, when they pass motion, they feel a lump that comes out from the anus, and subsequently it just reduces spontaneously. Another complaint that you usually have is itchiness. They feel that there is some itch and discomfort in the anus. Treatment for minor piles are just lifestyle changes. One, we know that if the person loves spicy food, just cut back on it. If a person doesn't even bother to eat any fruits and vegetables, and they are very constipated, and every time they pass motion, it's a big motion, it's traumatized, they have to stretch the anus. So these patients should go on a more high fiber diet, fruits, taking vegetables. There are other also this pharmacy that they can take, like for example lactulose. That will soften the stools and all these things. Fiber gel. When you reach a certain age, like you are close to your 40s and 50s, it is not just sufficient just to close one eye and then treat it with suppositories and tablets, because now you will be thinking about something like colon cancers. And usually the family doctors will refer you to the specialists in the hospital. And the doctors in the hospital will make sure that they do a per rectal examination. That's when he examines the anus to make sure that there is no swelling other than the hemorrhoids above where the partner of bleeding is. Secondly would be, he will usually recommend a thing called colonoscopy, which is an instrument, a camera that can be inserted through the anus when the patient is sedated. And we can see the rest of the colon, whether are there any polyps or whether any cancers that are concomitantly growing there. That may account for the amount of bleeding that such patients have. If, for example, the patient presents with more than just bleeding, that means it bleeds a lot excessively, then we would recommend operations. Now, operations can be divided into a few. Those that you can do as a day surgery, and you don't need anesthetic at all. Now, with this instrument, you are able to suck the pulp into this instrument and fire a rubber band at the base of the hemorrhoid. And it is equivalent to like hanging the hemorrhoid. After some time, 24 hours usually, the whole head of the hemorrhoids falls off. Alright, and then what happens is that you have an ulcer, but as the days go by, that ulcer heals and it closes the gap so that new flesh comes to grow over where the old hemorrhoid is, and so it doesn't bleed anymore. This is why ligation, this is one of the methods that we use that doesn't need general anesthetic at all. Another method that we use is called injection of oily phenol. This is a chemical that causes blood vessels to sclerose or dry up by itself. Now, again, this doesn't need anesthetic, and what it needs is a surgeon who is able to see and visualize where the pile is and inject the chemical just above the pile, so that the blood vessels that are supplying the pile can be dried up. And again, the same principle, the area will slough off and then it will heal by itself. Now, these are two most commonly used non-anesthetic methods for treating piles. Now, bigger piles, we would have to go under general anesthesia. Now, under general anesthesia, in the past, what we do is that we use the Milligan-Morgan method, where you use scissors to cut. Now, however, medicine has changed a lot, and now you actually use diatomy, which is equivalent to almost laser precision to the cutting out of the piles. And what we do is that when the patient goes under anesthetic, we are able to excise or cut the whole of the hemorrhoid with the blood vessel attached. And so the whole thing is just taken off, and either we leave it for the wound to heal by itself, or we can stitch the wound up. This is called closed hemorrhoidectomy. All right. Another way is a stapler method. This is called a circular stapler, and it is much bigger than that. It has a handle where it can be inserted into the anus, and what we do is that we can stitch and pull all the hemorrhoids into one bundle, and the stapler is able to cut off all the hemorrhoids and staple the good flesh together. This is called the circular staple hemorrhoidectomy. Now, lastly, the latest way of doing it is what you call the transanal hemorrhoidal artery. It's called THD, sorry, it's a lot. And what it does is that a lot of times when we do the surgery under anesthetic, you are not sure where the blood vessel is. So this instrument is able to identify precisely where the blood vessel is coming from in the inside. It's what you call a Doppler, and you can actually hear the beat, the heartbeat of the hemorrhoid. And where it is, we are able to tie the area up and stitch the whole area into the anus, so that basically the blood supply to the hemorrhoid is terminated. Risks and complications of stage 4 treatment, like any surgery, you go through the risk of anesthetic because it is an operation. The patient has to go get the gas and the injections to help them sleep. That is the risk for anesthetic. For number 2 is the risk for bleeding, because here we are actually cutting the pulse out. There may be excessive bleeding, but with the use of this diatomy, we are able to burn the blood vessels very precisely. Now, the third problem that you may hear in the past of patients coming out from such major operation is incontinence. Now, the problem with incontinence is because of the instruments that were used in the past, just scissors or just cutting with blades and all these things. Nowadays, it's very imprecise. We are able to minimize the wounds, and also at the same time we minimize the danger to the muscles. The muscles are called sphincters. They give us continence, which is able to control our motion. Now, continents are divided into a few degrees, whether it is related to the operation or not. You have incontinence to win. That means, let's say for example, you laugh very loudly and then you fart because you can't control. So you're incontinent to win. But you also know that you can be minor incontinence is when you have food poisoning, you have diarrhea, and again the water you are unable to control. But if you have normal motion, you are able to control. And then lastly, which we never see in the complications for hemorrhoid operation, what you call fecal incontinence, where that means like an old person who have no control of his feces, he has to wear pampers. This doesn't happen at all. So most of the time before the operation, we will tell patients that maybe you may get some flatus incontinence to win. And very seldom that you get incontinence to this fluid feces. We are starting to see recurrence in hemorrhoids because we know that some of these are hereditary. When you cut out a blood vessels, you cannot be, human body will never be completely devoid of blood, because the blood brings it the nutrition, it brings it the oxygen. So the body learns to form other channels so that it can supply to the anus. Now, if the patient already has a hereditary cause of hemorrhoids, yes, it can come back again. The second thing is, of course, you go back to the old habits. Old habits die hard. You go back and you eat all sorts of things are spicy, or you forget to eat, these fruits and vegetables. Yes, they will come back again. And I see that in patients who had operation when they're very young, when maybe in their 20s or 30s, and then by 60s or 70s, because they did not change their habits or they have a strong family history, it comes back again. Yeah, but they are less severe. Post-surgery care, most of the time, because of the new methods of operation, the wounds are very small. The medicine that you take would be for painkillers, and again that has improved a lot. In the past, you used to have to take medicine for 4 times a day. Now just 1 tablet is enough. Secondly, antibiotics. Antibiotics has the modern ones have less side effects. You don't get a lot of allergies and all these things. And then thirdly, you continue to use painkiller creams. Painkiller creams are readily available now after surgery, where you can just apply and numb that area. And you'll be surprised that after 1 to 2 days, you hardly notice that there is pain anymore. But I think I would usually advise the patients on something that is not related to pain or infection, but the spouses are rather unhappy about, because after any operation, the wounds have some secretion. It's yellow liquid that comes out. It's called serum. And if you don't have a liner, usually I would tell the patient, whether it's male or female, you put on a panty liner, at least the secretions won't stain your furniture. Otherwise, your spouse will be very upset. The bed has a stain and the furniture has a stain. And if you just adhere to that, after 10 days to 2 weeks, it just dries up naturally by itself.